All right, here we are live. So good to be here. I want to just take a moment to kind of frame things up and introduce my guest today. I'm chatting with Tanya Lehmann, who is based in Australia and whom I met a few years ago in Australia. She was one of the participants in our embodied practitioner certification program. And I was so impressed with her because when I came to that session and was, one of the presenters, I presented the MetaImpact framework, and she just took to it like a duck to water and was working on all kinds of charts and diagrams and ways of using it in the work she does in the context of healthcare. And so we've been in touch over the years since then. And knowing that in Iceland, we're going to be focusing on healthcare as a core topic to focus the seminar, I just thought it would be really useful to chat with you, Tanya, and just kind of pick your brain and explore the ways in which you've worked with, integral theory, the integral model, and aspects of the MetaImpact framework, and just to kind of see what we can learn from your notes from the trenches, so to speak. And, both in terms of kind of what's worked and then what's not worked and what's been challenging about using the MetaImpact framework in the context you're working in. So welcome, great to see you again and have you for the next half hour or so to engage.
Great, thank you, and thanks for the opportunity. I wish I was coming to Iceland.
Yeah,
it's nice to participate in some way through this recording.
Yeah, sure. Wonderful. So maybe just start with, that first week where we met and where you were exposed to the MetaImpact framework and the 10 capitals. Maybe just share with the audience a little bit about your background and what you do with South Australia Health, and then kind of tell us about that first exposure. What about the framework kind of lit you up? And then how did you start working with it and start trying to bring it into the work you're doing? And then we'll just kind of follow the thread all the way up to the recent award that you and your team got for the integral performance framework that you've developed.
Sure. Thanks, Sean. So I am a dietitian by background, but for the last few years I have been working in a whole of system role. So I work for Country Health SA, or Country Health South Australia, which is a local health network, as we call them, which spans about 1 million square kilometres, servicing about 500,000 people in all of South Australia other than the capital city of Adelaide. So it's a pretty big spread.
And it has about 8,000 employees, is that?
Yeah, 8,000 staff. So it's a big gig. And we're dispersed across some really remote parts of desert, really. And structured into six regions. And at the moment, I'm acting regional director of one of those regions and have been for the last couple of years. Okay. So how we came, when I was involved in the body practitioner program and Sean was there presenting on this framework, and what we'd been grappling with as a health service was that it just felt like we were looking at the wrong things, that we were, when we were thinking about our performance, we were consuming the KPIs required of us by the department rather than asking ourselves, how is it that we could improve our performance and what do we need to be paying attention to do that? So when we first introduced to the concept, we did a bit of a quick and dirty, really, snapshot of, let's look at the 4 quadrants, or the 4 areas of the MetaCapital framework, as you call them. Let's look at those quadrants and say, what are we paying attention to, and how? Let's look at our strategic plan, and then look at our performance framework and how it measures up. And what we found was that our strategic plan gave a nod to all of the areas of the framework. So it was talking about having staff that were can-do and were engaged. Right. And it was talking about skills and capabilities and building vibrant places for people to work. It was talking about having high-performing teams and providing quality healthcare. Right. And it was talking about having cultures that sustained people and sustained quality healthcare. So it was ticking all the boxes if you looked across all the capitals in terms of the intent in our strategic plan. But then when we look at our performance framework, the stuff that our managers were held accountable for and what they were being measured against, it was looking at systems and widgets, you know. So how many people in our beds, how long it took them to get them out of ED, and it was purely counting numbers and counting system and process issues. So very much about systems and processes. So we said, well, how are we going to achieve the strategic vision of our organisation, which is fairly lofty? It's to be the best rural health service. Right. How are we going to be the best rural health service if all we're focusing on system and data, which, by the way, is all retrospective? And, you know, it's like driving a car, looking in the rearview mirror and hoping that you don't crash. So what we said is, how do we become a bit more sophisticated? So then when I came across your talk on the MetaCapital framework, Sean, it was like, you know, what we need to do is develop an approach to how we look at our performance, because that becomes the tail that wags the dog. You know, our managers are being held accountable for that. It's what our executives are focusing on. How do we influence that so that we can shift what we're paying attention to and what we're investing in as an organisation to drive those improvements?
Well, and, you know, what you've just described is so typical in my experience, right? It's like the strategic plan, essentially, and the vision and the mission of the organization so often actually covers the 4 types of impact, because intuitively we want to have impact in those 4 major areas. We want to change behavior and the skill set. We want to change the systems. We want to take care of the people and make sure they're happy and engaged. We want to support the networks of relationship. So it's often there. It's not like people have to then bring that into what they're trying to do. But as you so beautifully said, too often the metrics that are used to try and assess that are the wrong metrics, and they tend to be exclusively third person in their orientation. They tend to be systemic. They tend to be kind of looking at the past opposed to either the present or the future. And so we're using the wrong set of metrics and assessments to try and evaluate the kinds of impact that we're actually committed to. And then we're incapable of assessing that impact because there's a mismatch between our metrics and our mission.
Exactly right. And so the challenge for us is that those metrics are handed down by the department. You know, we are a government organisation. It's fairly bureaucratic. So we don't get to ignore them. We still need to comply with those requirements. So the conversation then, well, how do we add to that? How do we expand it? Absolutely. So then we looked at, what metrics do we have? Because one of the things that I think we fall into is the trap of measuring what we can, not measuring what we value. Right. And so the things that at an executive level, looking across that very big organisation, across a large geography, lots of staff, complex healthcare, you measure what you can. So what data do we already have and what data do we already collect? And what we found when we mapped those things against the 4 types of impact, again, we were overly skewed to systems and process types of measures because they were the things that were objective and scalable, large, you know, so the reports that could be churned out of a computer, the things that we collected en masse, and the things that we wanted to pay attention to were harder to do that because they're subjective things. They're about people's mindsets and how engaged they are and the culture of the workplace, which is harder to measure, and it wasn't in readily available means of mechanisms of measurement. The only thing we found that did cross on all 4 types of impact was our staff survey, which was just new and we'd done it once, but it did ask questions of our staff around their level of engagement and their attitude and their commitment to the organisation and their willingness to go over and above, and the values that they brought to the workplace and that sort of thing, and how they interacted and how their relationships worked and were they effective or not. So we thought, well, there's a place to start there.
And how many people were asked to take that survey of the 8,000 employees? Was it just a subset?
They're all asked to. We had about a 40% response rate, so that's not too bad.
Go. That's really good.
And hugely variable responses. So again, it's that tension you're holding about when to localize your analysis and your response and when to systemize it. And as a system, our tendency is to go to the systemizing when we're talking about performance. So how do we bring a bit more of a recognition of the value of a more intimate, local, individualized elements as well as the whole of system elements? So we proposed to design a performance framework that would give a nod to all of the 4 types of impact, and then to implement a leadership development program starting in 2 of our regions. So, 2,000 or 3,000 people reach as opposed to the 8,000, and just to test it. So this was taking things a little bit outside the comfort zone of the public bureaucratic system. And so we had some champions that were identified at region level that would be prepared to expose their senior management teams and their leadership to different ways of thinking and different ways. So we rolled out some training on integral and on polarity management to really give them a bit new language and some new skills to take broader perspectives, to take the pressure off that they didn't have to have all the answers and they didn't have to know whether things were working or not, but they could be inquisitive and have a longer, deeper, wider inquiry into what was going on when they were facing performance challenges.
There's a great chart in one of the documents you sent me that have, the 4 quadrants or the 4 types of impact. And you kind of highlight, like in behaviors, right, and in clear impact, it's new ways of doing things. Whereas in systems, it's new ways of doing things collectively and measuring different things. And in the lower left, or in deep impact, or rather wide impact, it's culture is new conversations. And then for deep impact or mindsets, it's new ways of thinking and seeing. So I'm curious, like, as you were developing this new approach to performance and operationalizing it in the context of the 4 quadrants or the 4 types of impact, and emphasizing new ways of thinking and seeing, new ways of doing, new types of conversations, new systems, and new ways of measuring, how was that approach embraced, or not embraced, like kind of expanding the conversation around quadrants and polarities, and starting to bring in the notion of mindsets or conversations or new ways of doing things? Like, tell us a little bit about how was that received, what opened up as a result of doing that, kind of what were the dynamics happening on the ground?
The fascinating thing, Sean, is that we were focusing on an executive engagement element as well as the senior management level engagement. And what we found was the executives generally struggled more to come on board with the concepts. We explicitly used the MetaCapitals framework with that group and said, what are we measuring now and what could we be measuring? And we found a real difficulty to shift from that whole of system perspective to looking at whole of system shifts in our mindsets and what we're measuring and what we're paying attention to at the more local level or region level. So my region's a region of 1,700 people across, fairly big geography, 12 hospitals, a couple of medical practices and community health services that go all over. When you get more at the ground level, what we discovered that people were just saying, I'm in over my head. And I felt safer to say that. I'm in over my head. I need help. I need new ways of thinking about what I'm dealing with. And you know what? This concept seems really simple, but it really works and it's helping. So where we gained traction was when we applied it to really wicked challenges that people were experiencing in their day-to-day work, whereas the manager, they were being held accountable to fix it, but finding that a fix was a little bit evasive. So while our concept was to develop a performance framework for the whole of the organisation that aligned with our strategic plan, our way in was working really practically on real-life, in-your-face problems that people needed support and a new way of approaching things to take it forward. So examples such as a really entrenched issue with the length of stay, KPI, so keeping people in our hospitals for too long compared to our metrics. What was going on there? And actually going, well, this is not just about the KPI is wrong and we just need to tell people to do it better. It was actually recognising that there was some professional cultural issues between doctors and nurses. There was stuff going on the ground around our communication and our discharge planning process. And of course, there were some procedural elements, but there were also issues around knowledge gaps, around what people could be referred to get them out of hospital sooner. There was issues, certainly some power dynamics and some what people are losing when they let go of the patient that are in their care, and some of that's financial, some of that's giving over some power to other parts of the system. So there was a whole range of dynamics going on. So when we created the safe space to look at those things objectively and explicitly, it diffused a lot of those implied or undercurrents of power dynamics that were vested interests and things that were going on that were driving people's behaviours and their choices and their participation in a solution that were previously assumed but not really known.
Well, there's a lot there in what you've just said. I want to tease out a few pieces. One is just fascinating that the executives had this really well-developed systems mindset that in a sense kind of kept them locked into a certain way of thinking and seeing things. Whereas the people kind of on the ground, their pain point, it sounds like, was addressed by aspects of the framework, that the framework connected and helped relieve some of that pain. And that part of that was just by slowing down and mapping things onto the framework and into the quadrants, and this is why it's so powerful to use the framework to get away from just the strictly third person aspects of a situation. Because when you include the first person and second person, right, the subjective and the intersubjective, then you make room for the power dynamics. You make room for the feeling of being confused and overwhelmed. You make room for a lot of those elements that are actually where the stuck points generally are, right? And then you can work with informal approaches, methods, and metrics to kind of engage that and kind of break the log jam up a bit. And so it's really fascinating to me that the folks on the ground found a kind of relief with the framework that was harder for some of the leadership to fully get at first. So I'm curious, when the leadership saw the results and the value that this approach to performance was having, did they shift and open more to aspects of the framework, or is there still a bit of a gap there? Or kind of how is that polarity between kind of, the folks on the ground getting it and, the folks in leadership position still feeling a bit, kind of not fully satisfied that all the pieces they need are there?
Yeah, and I've reflected on it a lot, and I do think from the executive's perspective, it is being kind of stuck in the expanse of it and the complexity of it when you're thinking whole of system. Yeah. And so when they saw real life examples working at a level that was a stuck performance issue, that we just brought a really simple new process of sitting down with the different stakeholders and gathering their perspectives and coordinating them and looking for interconnections and how, if we shift this piece, how could that improve that part of the performance drivers that were getting in the way. They went, oh, that really works. So then they started to engage us in, actually, I've got there's been a restructure of some staff coming back from central back into our health network. Could we use these tools to help with a planning of moving our, from a centralised to a more decentralised staffing model for finance, for example? Right. Yeah, sure, we can use it for that. So there started to be, maybe we could apply it to this, and maybe could apply it to this. And actually it is relevant to my challenges, whether they're at the more localised team level or a more macro level. So what we found is that the momentum built, and I think, there's a lot of pressure on our executives to find the silver bullet and find the thing that fixes things at a whole system level. And so this has been a really good way of giving people what they need, like you say, addressing the pain points, and then moving, giving them what they want, they want to fix that pain point, and then moving to what they need, which is how to systemize it and how to embed that way of perspective seeking and the curiosity into looking then whole of system. So I think that was the big clincher, and there are there are a lot of people that see the huge merit in it, and we've been really focused from the beginning on how do we measure the impact of this, how do we measure whether this is making a difference, and we developed right from the beginning an evaluation tool that used all 4 quadrants, all level areas of impact. So we didn't skew our data collection to whole of system scalable things like surveys, although we had some of them. We used in focus groups, but we also used stories from individuals of individual examples of where conversations had shifted or mindsets have shifted. And so being able to sell the benefits of this across all 4 quadrants was a way of being able to then add some rigour to shifting the language. So role modelling how we shift the language through our approach to evaluation and reporting as well.
Wow. Well, and so much of what you've done is a perfect example of what seems to be emerging as the methodology of applying the MetaImpact framework. So the more that I'm exploring this and seeing how people are using it on the ground, it seems to be a version of what you're describing. And that is, basically kind of seeing what is the case now. And there's usually, as I mentioned, a realization that you have a commitment to all 4 types of impact kind of built in, but that there's a gap between the metrics you're using and that mission. And then you start focusing on the 4 types of impact and getting clear on, how you can make small adjustments that work within what's already happening, and kind of working with the commitments. Like, you already have a certain set of metrics you have to use, right? So you can't get rid of those, but you can add to it or kind of resituate those in a larger framework of understanding. So there's kind of a repositioning of the kind of more typical third-person systems metrics, and then finding where you can complement that with some other things. And so you had this example of the survey, which, started to kind of bring in kind of a wider range of data points, first, second, and third person. And then it's like you've operationalized impact in all 4 domains, right? So you're now have developed a performance framework that allows you to really say that you're having clear impact, high impact, wide impact, and deep impact, right? And so that's basically the ground floor of putting in place what you need to then go the next step. Whether you're able to do it in your organization or not, remains to be seen. But the next step would then be to then further differentiate those kinds of impact that you're having in those 4 areas using the capitals, right? So with the deep impact, and here in one of the diagrams you have, you talk about the integral approach to performance that Country Health has developed. So intentions and mindsets, you say, tap into managers' personal aspirations to be effective, to skillfully manage real performance challenges, right? So you could look at the kinds of measures you're using to measure that, and then you could ask yourself, okay, are those knowledge capital measurements, are those psychological capital measurements, or are they spiritual/existential capital measurements? So then you could start to put them in there. And then, then eventually you could, the next step would be okay, which ones of those are first person or second person or third person, right? So in a way, it's like you are using the MetaImpact framework, even though you haven't yet really brought in the capitals fully into kind of what you're doing. But
yeah, right. And I think the thing, so 18 months ago, I had your framework and I was, all with the zealous convert, took it to our executive and it just bombed. And unpicking why it did was because we were still looking at it as a 2-dimensional way of categorizing things.
Yeah.
And so to really move and to really realize the value of the Meta Capital framework, I think the focus needs to be on the value, not on the metrics. And so we were charged as a project team with, okay, we'll go away and come back with KPIs for each quadrant. Yeah. And as we worked in the processes, it was clear that KPIs is the language of the lower right quadrant. It's not the language of the upper quadrants. And so to then bring the Meta Capital framework to an organisation that didn't have the lexicon, didn't have the language of cultures and the language of mindsets and the language of capability behaviours, really prolific in its vocabulary, to try and use the Meta Capital framework, what we were finding is that it was being really diminished into an impoverished version of itself. So we took a step back from that strategy and then focused on building it ground up in terms of that language shift and that capability shift and that mindset shift and that culture shift. And when the time is right, I think bringing that explicit lens over it will be really valuable. But I think, so for us, the strategy that's working at the moment is to build the groundswell. So we're beyond tipping point now. It's an embedded way of thinking. So now it's not going to be such a scary thing or such an out there thing to say, well, how do we explicitly reference each of the capitals and how do we then explicitly link ourselves to the growing international body of evidence and rigour around value creation and capitals, and that language, which is not really common language, apart from in the social capital space we dabble with in health, but a lot of the other capitals, it's not the language that our organisation was comfortable with using.
Well, I love this because it's like you brought this framework that you really loved and saw the value of, present to them, and they were kind of like, I don't know, like, I'm not sure. But yet there was something in it, or something in your passion about it, that they said, why don't you do the KPI thing and the four, let's start there. So they're kind of trying to bring it back to something that made sense to them. But they were feeling and sensing something in you and your team, like, okay, let's let them carry this a little further and see what happens, right? And so now you've ended up being very successful in developing this performance framework, and it's getting traction. And now, like you were saying, like in 1 or 2 or 3 years, you can walk back into that meeting and basically use all the data that you've collected, over the last year plus and the next couple of years, and basically populate the MetaImpact framework and show all the capitals, right? And yet at that point, it'll mean so much more, and it'll be so different because it'll have emerged from the ground up, right? Opposed to kind of, the framework coming down. And I think your point about the KPIs is so crucial, and it's actually led me to kind of developing a new kind of layer to the framework, which I'll share with you. This is kind of hot off the presses because I've only mentioned this, I think, to a couple other people at different points. But it's like, I want to take ideas like KPI and kind of turn them on their head in the best sense. And you're right, KPIs is intrinsically connected to clear and high impact, right? The right-hand quadrants. And they tend to be almost exclusively third person and numerical in their orientation. So I've been playing around with it, and so I've changed it from key performance indicators to key progress indicator, right? So we keep the phrase KPI because that's so entrenched, right? But, we still could call it performance, but I like progress because you can make progress in any of the 4 types of impact. Performance still has this kind of individual, agentic, kind of masculine, kind of dynamic. Progress does too a little bit, but it's not as bad, I don't think. But so if we think of KPIs as key progress indicators, and then we think of a different kind of KPI in each of the impacts, so that in clear impact, we have key proficiency indicators. And high impact, we have like key pattern or process or production indicators. And wide impact, we have key partnership or key participation indicators. And then in the deep impact, we have key perception or key presence indicators, right? So I'm playing with the language, but the idea is like to kind of redefine KPIs so that we actually can talk about KPIs in each of the 4 impacts, but we're not just meaning performance, right? And just exclusively third-person performance, or objective performance. So, like, how do we kind of reclaim that notion and expand it so that we can talk about KPIs in each of the 4 quadrants or impacts? Because the way they're currently defined really only allows them to be in the clear and high impact.
Yeah, I love that, Sean. That's got massive potential. I'll take that.
Good. Please, take it and build on it. Let me know what works. So this is awesome. So tell us, kind of bring us up to the point of getting the award for developing this framework, and kind of what I would imagine is the vindication of so much trial and error and blood, sweat, and tears, and just kind of that process of taking the organization to the point where they really could see the value of what you had created by using this 4-quadrant approach to performance, and kind of laying the first layer of the MetaImpact framework in terms of the 4 types of impact, and being able to create an organization that's now committed to tracking and measuring impact in those 4 areas. And you've really created a new level of expressive capacity for the organization to be thinking in this kind of more multidimensional and polarity management way. So tell us, what was it like, and how was that process of kind of getting from where we were just talking about to the place of being on the stage, getting an award? Oh, we have frozen for a moment, so let's give it a sec. Great, we're back.
Yeah, it's an interesting question, Sean, and I'd like to be able to say that it was by some great design, but in actual fact, the reason we applied for the SA Health Award was part of our executive engagement strategy. So we knew that our CEO read every application, and that we didn't feel that we got enough traction at the executive level in terms of recognising how successful this was being, that it was so ground up that it wasn't necessarily finding its way all the way up.
Yeah.
And initially our intention really was just to bring it to the attention of the CEO of our part of the organisation. And so when it was brought to her attention and it was put forward by the executive as one of the ones we would put up to SA Health, it's like, yay, we've accomplished, and didn't really expect it to go all the way.
Wow.
But then we were told we were finalists.
Oh my God.
Well, maybe there's something in this. So of the hundreds of applications from across SA Health, across all of South Australia, then we were finalists. Well, you know, what we were really clear when we wrote our application was to make sure we were focusing on all 4 types of capital in how we were describing our story and how we were presenting the benefit that was accrued, including those personal mindset shifts and culture shifts and the progress towards that, and as well as capability development. So we knew that in previous awards, awards had been received for rolling out leadership programs that were impressive because of the scale, and we knew that our scale was bigger. We knew that it reached more people, and so maybe it had a chance. But the stuff that we didn't know if it would gain traction over, stories of the sorts of things that our organisation across SA Health, so the SA Health system, historically had celebrated were triumphs of fancy new technology or a really patient based service improvement, and ours was in the category of non-clinical services. So as a health organisation, the stuff that we tended to celebrate was the forward-facing care elements rather than the behind-the-scenes elements. When we were finalists, I thought, wow, that's pretty cool. And then when we won the award, our CEO was so excited and is still bragging, because not only did we win for what we were doing across SA Health as the best example of excellence in non-clinical services, but a number of the other country health awards that won in other categories, we had been involved as a project team in supporting them on their strategy and what they developed up. So it was, a triumph, not because of the award itself, but because of how effective that strategy was in really executive engagement, and the projectile, the projection of the visibility of the work that we were doing.
Wow. That's amazing.
Yeah.
Congratulations. And tell us the exact name or nature of the award, and then also kind of your sense of what are the next steps of what are you wanting to accomplish in the next year or two, given the momentum that's been building around your work in this area? Yeah,
sure. The award was great, but it's not the end goal. It was just a little bit of collateral along the way. The main focus now is really shifting this into really embedding, and then when we're ready to revisit that explicit connection to the types of capital and our metrics, and really informing that. So we haven't had a huge impact on what our metrics are from a performance management point of view. What we've influenced so far has been our approach. So when our KPIs are in the red, then how do we have the conversation about what's really going on here, and what strategies are developed are being done through an integral lens. So we still haven't cracked that nut of informing the KPIs that we're monitoring, however we define the P, where the step before that about saying, well, that's the hard nut to crack, how do we step back from that saying, well, okay, how do we respond to performance challenges as an organisation, and use that as a way of bringing this focus through. So next week we start on our next phase 2 or phase 3, whatever phase we're up to now, which is about really embedding the integral capability. We've got our partners in this, so Dana Carmen from the US, who a number of people may know, and some others in his team working with us in partnership to really deepen our skills across not just the project team, but a growing group of about 30 or 40 leaders across country at all levels that have really embraced this way of thinking and perspective seeking and analysing and planning, who are going to come on a journey of us to really establish formally a range of constructs that will embed it so I can't ever get unstuck. So things like communities of practice and really giving a nod to trying to push into that space of the performance metrics that we use as an organisation. So that's our next horizon. Really excited about next week's workshop, which is an expanding and a deepening of our skills and our skillful means of applying these things, as well as the project team is still growing strong in terms of our passion and our commitment, and we do have, I think, a unique opportunity in the wake of the award to really leverage and grow from here. So watch this space.
Yeah, congratulations. It is exciting. Let me double click on one of the areas that I think would be really useful for us to explore. So I want to read again from this document you sent me of the Country Health Essay Integral Approach to Performance, and I'll look at wide impact. And then I'll read what you have listed as the outcomes that occurred for that space. Mm-hmm. And then I'd love for you to just talk about what were some of the metrics that you used to kind of assess those outcomes. So what I have written on this chart here is that for culture, or what I would call wide impact, the intention was to grow an action learning culture, working in teams on real problems, sharing stories of success and failure. Mm. And then what I have listed of the outcomes that occurred in that space were three things. Leaders were able to better identify organizational, team, and professional culture factors impacting on performance. Project team reported leaders gained valuable insights and connections with peers through action learning groups and observe an action learning culture emerging. And lastly, action learning groups demonstrated value of peer learning and its impact on leadership culture. So those are all three great outcomes connected to your commitment to deep impact in the way that it was defined here. So tell me a little bit about what were some of the ways you measured that to be able to really assess those outcomes.
Yeah, so this is always a tricky one to measure. So what we identified was that one of the things holding us back as an organisation in this space was our being a little bit overly enamoured with experts and about knowing, and that sort of stifles curiosity and perspective seeking and valuing the breadth of understanding that could come from being a bit more curious about what else is going on that we don't know about. And so the action learning group construct really helped us in a couple of ways to create a safe space for our leaders who had been through a workshop and learnt the concepts, and then we said, go forth and apply to your challenges, how they could apply them in a way that was safe to learn as they were doing. And that in itself had a big impact on them individually and how they reported shifts in their level of comfort and their mindsets in terms of their willingness to have a crack, have a go. Right. And you could see the impact that itself had. So when you brought together a group of people, for example, looking at the wicked challenge of our emergency department wait times, that historically the power dynamics and the hierarchy of our organisation would dictate that the emergency physicians should come up with the solutions. And so looking to that hero leader as our, the archetype and the power dynamics in our organisation, what these tools enabled was the ability for everyone around the table to be valued for the contribution they brought and the perspective they brought. So what, in terms of your question about what metrics we looked at, we did buzz surveys every couple of weeks where we just asked our participants in those action learning groups to name how many times they'd thought about the different quadrants, how many times they'd applied it, what sorts of things they'd applied it to, what they've observed in the interactions in those teams that they were working with. and were then able to chunk those into themes and scale that as a whole of system metric. So a fairly in labour intensive, and in my experience, because of the left-hand side quadrants, the subjective quadrants are the only way you really find out what's going on is by asking people and having a conversation. It's hard to translate that into a metric. Yeah. And so, yes, it is more intensive than pushing a button and producing a data report out of a system. Right. Richness is there. So it's fair to say we're all still on a bit of a journey about how to do that really well. The other thing other metrics, if you like, that were used in that space were stories. So we got all of our action learning group facilitators to share examples of integral maps they'd produced, polarity maps they'd produced, and we've stored them on a share drive that anyone could access. Right. So that was a way of capturing the artefacts of the learning and of the processes, but also to tell then stories. So we interviewed people and stepped them through questions that were structured around all 4 types of impact to describe what the issue was, how they went about it, and what their outcomes were. So in all ways, the way we evaluated was as much the metric itself and the way of demonstrating how you focus attention across all of the types of impact, not just in what people were doing and how they approached it, but then how we drew out those stories. So the stories ended up being the stuff that was most powerful. And it is tricky to succinctly describe what you've observed in culture shifts and what you've observed in yourself in terms of your mindset shifts or your motivation shifts. But you can do that if that's what you value and that's what you want to pay attention to.
Oh, well, this is so illustrative of some really key points that I want to try and pull out. One is that so often getting data for deep impact or wide impact is really simple, right? In some respects, it can be time intensive, right? It can involve, it can be hard in that sense but it's like just sending out a survey, capturing the stories, like taking pictures of the maps and diagrams that people make, right? So there's a way in which it's pretty straightforward and simple to kind of capture the data. It is, more involved and then sort through it and figure out how do we convert this into, a measurement and how do we make sense of that and what does that look like? But this is where, in the MetaImpact approach, we really emphasize visibility over objectivity, right? So the goal is to make it visible, not necessarily to make it objective, because if the goal was to make it objective, then we have to figure out how we convert the stories to numbers. And then that's usually a bad way to go.
Well, it diminishes them. It really does. Yeah.
Totally. Yeah. And so the emphasis is on visibility, right? How do we make this visible so we can see it, we can sense it, we can feel it, right? So a story is a powerful way of making something visible, right? At least in an auditorial sense, right? You hear the impact that the people had, you hear the transformation they went through, you hear the pain point and then how that was overcome through learning how to use this new skill or this new way of thinking, right? So this movement towards visibility is really key when it comes to kind of making sense of the data on the left-hand side, especially the first and second person data points, because they're not numerical. And then it's like you used a variety of things. You use stories, surveys, interviews. And even though it's more time intensive, so I'm going to ask a question here. I'm guessing that it took less time than it did dealing with all the stuck realities that occur otherwise, right? So while it's kind of time intensive up front, the freedom that comes from it actually probably saves you time in the long run. So I'm curious if my sense there matches your experience of like, do you think ultimately you actually saved more time in the process and allowed there to be more fluidity between the dynamics than what would have been the case otherwise?
Yeah, it's an interesting question, Sean. My observation is that the stories of the things that worked and how stuck we were and what we'd tried before and why that didn't work and how we'd shifted, those were the things that really engaged our executives about, wow, this is really working.
Okay, yeah.
And they were the stories that were celebrated amongst teams about, wow, that's a really different outcome to what we're expecting. That's not what we did the last time, and it's worked differently. So they were the, we had a few high-profile stories that would get wheeled out at every opportune moment as a way of illustrating the impact.
Right.
And honestly, all the numbers in the world don't count up as powerfully as a personal anecdote or a story that shows how people are shifted and how results are improved as a consequence of just thinking differently, involving a broader range of people in a conversation, and about shifting the conversation to be, I wonder what else is going on here, and to absolutely have some structure to how you focus your attention comprehensively instead of getting tunnel vision down a particular path. And that's the stuff that I think was most powerful, and where we do see efficiencies is now we can just cut through all of that patch protection or tunnel vision stuff by saying, actually, let's take some broader perspectives here. What about systems? Yeah, we've got that in spades. Let's think about what impact mindsets are having in this, and the power dynamics and the relationship issues in our workplace. How are they impacting on this? And so now we've got a language where we can do that in a way other than saying, you know, whoa there, hang on, you're being a little bit personally precious. So it just creates, again, a more objective space to put the thing out there and look at it. So even if what we're measuring and the way we're describing is subjective, once you capture it in black and white, or on a video, we made some great videos for a few things. When you do that and people can see it, then they're looking at something that they've got a bit of distance from, and they can see it more broadly. So that's the powerful stuff from my perspective. That's the stuff that was the tipping point for us, is in being able to create the space for that sort of things to be noticed, as you say, raising the visibility of those sorts of things. And actually we do value those examples, and we do value those stories, and as an organisation we can celebrate those just as much as we can celebrate a 2.5% increase in
No, totally. Well, and what you've just shared just really highlights for me why I often talk about the value of the MetaImpact framework as a way of being able to tell better stories. Right? Because I've seen this in almost all the examples of it being applied, where the organization is able to tell a more powerful story about who they are and what they're doing as a result of working with the 4 types of impact, working with the different types of capital. And a lot of it is because the framework allows them to close what I call the metric mission gap, right? The gap between the metrics and the mission. And we talked about this at the very beginning, right? They have a 4 impact mission and vision, but the metrics that they're using are not the right combination to really assess that impact. And so now with this integral performance framework you've developed, it's closed that gap. And so you get your 2.5% increase here and there, and you can track that and celebrate that. But alongside that, you have these stories. And those stories are often the driver, right? They're really where the heart and soul is, and it's how we generally respond. So it's kind of like the framework, even though it's a very kind of abstract framework, it's actually like brings the heart and soul back into the organization because it allows you to tell powerful stories. So it's so great to hear you speak to that and that you actually experience that, because I'm noticing more and more that that's one of the core things that this approach offers. And even our conversation today and the story that you've shared with us is just so inspiring and touching that it just really makes me very happy. So thank you.
No, thanks for the opportunity. I mean, this has been a huge amount of work by a dedicated team.
I bet.
The core team, because we were working with Dana from America, often we needed to touch base at a time that would suit with everyone's busy schedule, and we were often meeting at 6 a.m. in the morning here because it was what could work there. And so this is something that it's been a mission for people to bring this into the space of our organisation, and something that they're personally really strongly committed to and strongly invested in beyond their 9-to-5 job. And that, I think, has been part of the success. It hasn't been a top-down strategy, it hasn't been led by an executive decree, and it hasn't been a bottom-up crisis management approach. It's been both up and down, and that real team effort and the breadth of skills of people involved in it. And for us as an organisation, had a little bit of a history of bringing in external experts, and then depending on what they suggested, either poo-poo it because they couldn't possibly know what was going on in our organisation, or putting it on a shelf dusty, to really all the way through this have a very strong ethos of building the capacity and skills and capability internally by partnering with experts that have the expertise that we don't have in the organisation. And we've paid a lot of attention to that. So it's been as much about our processes of building and growing and widening and strengthening all the way through. And I think that's one of the key elements in any change effort. It can't just be something that's designed by a couple of people in a room and then promulgated. We didn't know we were going to end up here, Sean. It was evolving as it went in, and as we thought, let's design some KPIs for all 4 quadrants. And actually, we need to park that because the time's not right for that to come through yet. So having your feelers out about where the thermometer is in terms of the readiness of the organisation to accept different types of language or different methodologies or different approaches. And you have to be committed to this ongoing experimentation and curiosity on how can we build this. So, that's really probably, really acknowledge the work of all of the team in being committed to that.
Yeah. Well, and I've just been so happy that Dana and Simon have been involved. I know Dana has a long background in healthcare and integral, and so I just been really pleased that he's been, part of the support team and what you guys have been doing. And again, congratulations to all of you. It's slow going, but you're making really big inroads and really shifting things. And you're also creating examples that are inspiring to other people out there who are wanting to bring these ideas into their organizations, and that's a big reason why I wanted to chat with you today and capture this on video, is so that people can hear more about what does this actually look like in real time in organizations, especially a big healthcare system in Australia, so that we can start to cross-pollinate and be inspired by each other. So thank you so much for your time today. And I look forward to, in a year or so, circling back and having another conversation with you and seeing where things are at that point.
Yeah, I'd love that, and I'm really excited to hear what comes out of the coming together of passions and minds in Iceland and where that takes things as well. So happy to stay connected, Sean, and participate and support in any way we can.
Great, wonderful. Thank you.
No worries.
Hold on just a moment.